Now we will scanning the right hypochondrium. Here we see the left lobe of liver and gallbladder. The gallbladder is full. The walls of gallbladder appears to be echogenic and thickened. The gallbladder contains sludge and stone. Now if we focus on the fundus of gallbladder, it is prominent and distended, gives appearance like balloon. The gallbladder gives appearance of overdistension, so we should rule out the gallbladder outlet obstruction. So we will scan the neck of gallbladder. Here we see a calculus present in the neck of gallbladder causing acute obstruction. Now we will measure the length of gallbladder. The gallbladder is overdistended and its length is 122 millimeter. The normal length of gallbladder is up to 100 millimeter. Now we will measure the size of wall of gallbladder. The gallbladder wall is thickened 5.3 millimeter. The normal size of gallbladder wall is up to 3 millimeter. No pericholecystic fluid present. Now rotating the patient at left lumbar position to locate the stone in the neck of gallbladder. Here we see the stone in the neck of gallbladder. Now we will measure the size of the stone. The size of the stone is 16.9 millimeter. The liver is normal, no mass lesion present. The intrahepatic biliary channels are also not dilated. Now how we will write report.